Hi, welcome. Thank you for joining. We're just letting people come in and get settled in before we start. The chat is now live, so we'll welcome everyone to please introduce yourselves in the chat if you don't mind. I'm Meg Davis, professor of digital health and rights at the Center for Interdisciplinary Methodologies at University of Warwick, and I will put that in the chat. But please go ahead and introduce yourselves, tell us who you are, where you are calling in from, and yeah, look forward to getting to know each other a bit. Thanks. Great, thanks. See a lot of typing going on. Really great to see people settling in. I'm going to go through a slide that shows how to turn on captions in case you want them. But basically, if you click on more at the top of your screen, thanks, Javier, that's great. If you click on, and I'll explain it again when more people are here, but if you click on more at the top of your screen, a box pops up at the bottom, and then you can choose which language you want to see captions in. So that's helpful. Thanks, Javier. Perfect. Really helpful. So I think most people on this call will be speaking English, but we do have colleagues calling in from different countries. So really nice that AI facilitates captions for us, even if sometimes they make really funny errors. But it's better than nothing. So please go ahead and turn on the captions if you like. Thanks. Welcome to those just joining us. We're just giving people a moment to come into the space and settle in. Please take a second to introduce yourself in the chat and tell us who you are and where you are calling in from so we get to know who is in the room. Thanks. We'll start maybe a couple minutes past the hour. Thank you. Welcome, everybody. Thank you so much to everyone who has been joining. So I'm Meg Davis. As I said a moment ago, I'm a professor at the Center for Interdisciplinary Methodologies at University of Warwick and project lead for the Digital Health and Rights Project. And I'm also joined today by my colleague Tara Imalingat, who's advocacy and impact coordinator and who's hiding right now, but we're going to make her come out shortly and show her face to us all. So welcome, really pleased to have you with us. Thank you so much for joining. And we're excited to have this really important first in a series of 3 conversations on strengthening digital health strategies by addressing gender, equity, rights, and inclusion. And each of these conversations focuses in a different geographic region. And this first region, we're going to focus in Africa. Maybe I'll just ask my colleagues to advance the next slide so we can see what we're going to be up to today. So we've got this wonderful collection of speakers, and we'll just briefly introduce each of them and then in more depth when they speak. So in addition to myself and Tara, we also have Sanjeev Pugajendi, who I hope will correct my, I'm sure, complete mangling of his name, who's very happy to have you with us, sir, from the Seychelles, from the Ministry of Health. Alia El Yasser. Oh, hi. Yes, go ahead.
Oh, I just said thank you.
Thank you. Wonderful. So Alia El Yasser has joined us from WHO. From the Gender, Rights, Equity, and Sexual Misconduct Prevention Department. So welcome, Alia. Great to have you with us. We have Ndifanji Namacha, who's joining us from Transform Health Coalition. James Kilu, who is with us from the Community Advisory Team in Kenya for the Digital Health and Rights Project. And Derek Munin, who's joining us from WHO's Digital Health and Innovation Department. So really wonderful to have you all with us today. We're excited to have this conversation. I'm going to quickly just kind of frame the discussion a bit. And then what we're going to do is have Tara will share a bit about a checklist that we've been drafting to help us guide discussions about gender, equity, and rights in digital health strategies. So it's just a draft and just to kind of get us thinking together about what some of the issues could be. And in addition, we will then have our panel discussion. But before we do that, we'll also have some comments from Derek to help frame the conversation from WHO. So maybe just to begin with, I'm going to pass over to Derek to say a few words of welcome and to frame the conversation. As we know, he has to get back to his meeting. Yeah, sorry, I'm jumping around in the slides, but I know Derek is here and he doesn't have long. So maybe we'll just turn off the slides, and then we look forward to hearing Derek share a few thoughts from the Digital Health and Innovation Department. Welcome, Derek.
Thank you so much. Can you hear me?
I can, though we can't see you. I think maybe we just need to change.
Okay, my camera is actually on. Can you see me now? I'm right here. Can you see me?
There you are. Yes. Thank you so much,
Okay.
Derek. Please go ahead. Thanks.
Thank you so much, Dr. Meg Davis, and thanks so much, distinguished participants from wherever you're connecting from. It's a pleasure to be able to meet together to discuss this extremely important topic, and just to thank Professor Meg Davis for the excellent work that we've been doing together around advancing the specific issue of preparing national strategies for the transformation that we are looking for. My name is Derek Munene, as has been mentioned. I'm in the Department of Data, Digital Health, Artificial Intelligence and Analytics, which is a transformation of the previous Department of Digital Health and Innovation, where I used to serve as unit head for capacity building and partnerships, and now will be taking on a role from January as team lead for a team leading with assessments, partnerships, and planning. And the assessment piece includes assessing to what extent countries are adopting national strategies, to what extent countries including vital parameters such as we're discussing today. So it's really a pleasure to be represented here, especially at this particular opportune time where member states continue to express their interest in the transformation of the health sector. We're just coming from the World Health Assembly this year that approved the global strategy on digital health for extension until 2027 to pave way for a new strategy that will cover 2028 until 2033. And one of the remaining items that we are yet to advise our member states in the current strategy, which warranted extension, is really this inclusivity dimension that the fourth objectives of the global strategy on digital health covers. It's extremely clear that the digitalization of the health sector is drawing attention from many actors. We're seeing a lot of uptake of emerging technologies such as artificial intelligence, blockchain, Internet of Things, and etc. But without robust national strategies that govern the implementation of these instruments, these emerging trends, the implementation remains siloed. We're pleased to see that in the African region, more and more countries are beginning to adopt national strategies. There is a growing momentum on innovation that is driven by national plans. Yet, as we see this progress on digitalization, we see limited attention to the issues that are so important but remain neglected, such as interoperability, inclusiveness of people parameters such as gender equity and rights. The transformation of the health sector depends on technology processes, but at the heart is people. And so as we discussed today around the issue of gender equity and rights, let's remember that designing national strategies for sustainability involves planning now the issues around equity, rights, and gender within the plans so that the implementation of digital strategies is inclusive, equitable, and leaves no one behind. Excited to be part of this conversation, and congratulations to the organizers. We look forward to a truly engaging session. Thank you so much, Dr. Davis, and back to you.
Thank you so much. It's really a pleasure to have you here to set the tone and to remind us of WHO's strong commitment on these issues. So it's really appreciated. And I hope you can stay a little bit, but I know you guys have a retreat today and very busy always, much in demand. So yeah, understand whenever you need to step away. With that, we're going to do a little bit to frame the conversation and just explain why we got ourselves involved in thinking about these issues. So when my colleagues are ready, I'll share the slides and just kind of get started in thinking about why we're addressing gender equity and rights in digital health strategies. And so as Derek Manini has just explained, this really begins on the next slide with the work that we've done as a consortium as a Digital Health and Rights Project. We're an international consortium of civil society groups, academic researchers, human rights lawyers, and networks of people living with HIV, working together in 10 countries, 10 different organizations, but focusing especially in Colombia, Ghana, Kenya, and Vietnam, where we've been doing research jointly with diverse young adults to understand how the digital transformation of health affects their human rights. And so, as you'll see on the next slide, we really took our starting point from the research that we've been doing, which has been published in numerous reports in British Medical Journal, Health and Human Rights Journal, and others, really working together to develop the highest standards of evidence. And then in the next slide, you'll see we've put together some resources in our Digital Empowerment Hub on our website, over 200 resources of human rights trainings, tools to use in workshops, videos, and more, to really try to promote digital citizenship, engage digital citizenship among all of us in our diversity, so that we begin to claim our rights in the digital age and make sure that the technology and AI that's being developed really works for all of us. So one specific little spin-off project that has taken on a life of its own, developed in conversations with WHO when they launched the Global Initiative on Digital Health. And on the next slide, you'll see the reminder of what Derek just spoke about, which is this commitment to the global strategy on digital health. And as part of that, they launched a global initiative on digital health and gathered all of the digital health strategies that they could obtain from different countries. And so when we met with colleagues in Derek's department, one of the questions we asked was, how are these strategies addressing health in regards to diversity of different groups, women's health, addressing human rights considerations, privacy, the digital gender divide, online abuse, all these different issues that we're also experiencing in the digital age. And so WHO encouraged us to take a look at some of the strategies. And so we reviewed 20 strategies. So you can see on the next slide. Sorry, I'm going really fast because I want maximum time for conversation and not too much time for academics droning on about their research. But what I did want to share is that we did this report looking at 20 strategies, and what we found is that gender equality was almost entirely absent. Despite everything we know about the digital gender divide, it wasn't being considered in strategies. We found that most of the strategies had very little reference to rights, very little reference to equity, and that most really didn't consider the fact that different populations will have different needs in the digital transformation of health. You can't really have a one-size-fits-all approach. We really need to think about rights of persons with disabilities. We need to think about the different needs of young people and older people, about gender inequality, about the needs of LGBTQ populations, the needs of migrants. So there are many different people who are going to be affected as we begin to move more and more online in different ways. And so this research had led us to understand that there's a need for a broader conversation. And so we started this webinar series not aiming to position ourselves as authorities, because I think we're all learning together at this moment, but rather to see how we can create space for a conversation among experts like the ones who we're fortunate to have on this call. So that's really what we're aiming to do. And then, what I'm going to do next is pass over to my colleague Tara, who formerly worked with Kaylin in Kenya and was a researcher on this project and now has joined us to coordinate advocacy and impact work. Tara is going to present a project she's working on to develop a checklist that would be, again, a tool for conversation to support discussions at country level about what the gaps might be and how to address them and which partners need to be at the table to address gender equity and rights in digital health. So Tara is going to quickly present what she's been working on. It's a draft. We really welcome conversation about that. We're then going to go to our panel discussion and talk about what are some of the challenges, and especially noting that there are a variety of countries right now that are about to develop digital health strategies. Seychelles is just one. There are others on the call as well. And what are they starting to think about? And then we will open it up for Q&A and for an open discussion. So really looking forward to that. And with that, I'm going to pass over to Tara. The floor is yours.
All right. Thank you, Meg. I hope we can all see and hear me. I think we'll just get started. Next slide, please. All right. So as Meg mentioned in her previous slides, our review of the 20 digital health strategies really revealed several gaps, included limited to no mention of gender equality or rights. Most did not fully consider the needs of diverse populations, nor did they show evidence of collaboration with civil society and other government ministries. We also noticed that emerging issues such as the role of AI were not discussed. And finally, none of them really acknowledged the growing need to strengthen digital health literacy among the broader public. And so recognizing these gaps and the need for tools that can support inclusive and equitable strategies, we drew on our review and other evidence and drafted a draft checklist, as Meg mentioned, on gender equity, rights, and inclusion in digital health strategies. So what we did is we decided to structure the checklist around 6 key thematic areas that we found commonly form the foundation of national digital health strategies. So under each of these sections, you can see we have included a set of guiding questions, which are really designed to help facilitate discussions and ensure that strategies are grounded in human rights and are people-centered, like Derek mentioned. So the first area really focuses on the vision and mission of the strategy. And here our goal is to make sure that the core framework, so basically the very foundation of the strategy, explicitly embeds rights, gender, and equity as core values, as well as guiding principles. So under this section, we also wanted to ensure that strategies really align with international, regional, and national commitments, so that, on health equity and related human rights. The next area really focuses on the situational analysis which really aims to ensure that strategy developers are really thinking about the types of data and evidence needed to understand their context and to identify and assess what their strengths, weaknesses, opportunities, or threats might be within the broader digital health landscape of the specific countries. So here we're really thinking about, what countries know about their systems, what are the gaps, and how to address these gaps, especially those affecting marginalized populations. With respect to legislation, policies, and regulatory frameworks, while we know that digital strategies are not legally binding instruments, they can still play an important role in shaping and strengthening the policy and legal environment around them. Could we please go back to the first slide, please? We've moved ahead quite a bit. Thank you. So, for example, a really well-designed strategy can help implementers reflect on whether the existing laws and policies are robust enough to support a safe digital health transformation. So, for instance, the strategy proposes the development of new health data protection policies or the review of existing data protection laws so that we can close governance gaps. The questions under the governance and infrastructure section really look at whether health technologies and solutions themselves, such as health information systems, telemedicine, and mHealth platforms, are designed and implemented with the unique needs of the end users in mind. So we also want to ensure that they address barriers to equitable and accessible health services across the different populations and also at different levels of care. So, for example, does this strategy consider how to address data leaks or cyber attacks, for instance, or ensure that strategy implementation team includes gender and human rights experts so that they can be actively involved in the management and oversight of different planning activities? When it comes to building capacity, we want to emphasize the importance of a more intentional rights-based approach to education and training. We really believe that this should not just focus on healthcare workers, administrators, or community health workers, though of course we know they are essential, but we really feel they need to extend to the broader public. So really ensuring that everyone has the knowledge and skills they need to fully participate in the digital health ecosystem. So that includes digital health programs, particularly those developed for marginalized populations, such as people living with various disabilities. Finally, we really want the strategy implementation plan to actively reduce the inequalities we're seeing today. So these questions under this last section really aim to encourage meaningful consultation with a wide range of stakeholders, including civil society and other ministries outside of the areas of health and ICT. They also look at questions around M&E and budget allocation for implementation. Next slide, please. Right, here we have some guiding questions under the first section I explained just now, which are really designed to help ensure that the strategy is truly grounded in a human rights and gender and equity lens. And one of the key questions we've asked is whether there are any existing national strategies, for example, on gender, youth, or human rights, that could be aligned with the digital health strategy. We really believe that making these kinds of connections can significantly strengthen implementation and really help strategy developers build on the evidence and progress already achieved through these other initiatives from these different ministries. Another important question really looks at whether there are existing government commitments, whether it's through the United Nations or regional human rights systems related to human rights or gender equality that the digital health strategy could contribute to fulfilling. This alignment, we think, is really, really important because it really helps ensure that the strategy not only advances the digital transformation, but also supports broader national and international commitments to either equity or inclusion. Next slide, please. We also spent some time thinking about the types of data that would be needed to sort of inform these equitable digital strategies we really want to see. Some of the examples we've included on this slide, of course, there are many more, but focus on data related to gender divides, really understanding where and why these gender disparities exist. We also included documents or assessments that map digital infrastructure gaps, particularly in rural or, as others say, hard to reach areas. What's equally important, we thought, was having evidence on, digital use and uptake, data that shows who has access to these technologies, who doesn't, and whether barriers such as, cost, connectivity, or affordability are really being considered and addressed. We also highlighted the need for data on the experiences and needs of people with disabilities. I think that's a group that's not really discussed enough, and other key populations that we talk about a lot, to ensure that accessibility and inclusion are really built into the digital health systems we're using from the very beginning. And so another one I thought would be good to highlight is, if the ministry really takes, having consultations with these different stakeholders, then the reports that come from those discussions would really help to frame their strategy and really ensure that, as Derek and Meg has said, really leaves no one behind. And that's truly the goal, especially if the right stakeholders and the right stakeholders with the right expertise are consulted. So these are just a few suggestions, but we are hoping that the list really sparks other ideas of national or regional strategic information or expertise that you feel would be relevant to your specific country context. So yeah, we'd welcome any other ideas you could provide. Next slide, please. So the checklist also includes a list of reference materials that can be relied upon. So as you can see from the list, we've got international, regional human rights treaties, recommendations in UN Human Rights Periodic Review Outcome Reports, UN Human Rights Treaty Body Reports, and concluding observations. We've also got UN normative guidance on human rights, gender, and digital technologies. And speaking of UN guidance, we have compiled an annotated list of available UN guidance, which you can find on our website, the DHRP website. So please take a look when you have a moment. We think they're very, very useful and hope that we can use them more as we work towards this joint and collective goal. So yeah, again, these are just suggestions. And of course, they can be built upon as more guidance and reports and other evidence is developed over time. Next slide, please. So in terms of next steps, we are going to be finalizing this checklist and getting feedback from, of course, our consortium members. We have an amazing group of consortium members with amazing expertise. And then some of our partners, including our partners at the WHO. And we would also want to then look at getting this checklist reviewed, peer-reviewed by a range of experts, before launching it officially next year in January. So please do sign up to our mailing list and keep an eye out on our website for any updates. I'm sure my colleague Javier will be posting in the chat as the discussion goes along. So please keep an eye out for any links he will probably share. Next slide, please. All right, so this slide shows the list of member states with plans to develop their digital health strategies in 2026 or in 2027. As you'll see, this is a very diverse group of countries. We also know that there are many other countries that may be revising and updating their existing strategies. So I think this conversation remains very, very timely. We hope that you find this information useful. And if anyone in the audience can share more information on the countries revising or developing their strategies, kindly share it in the chat or contact us directly. I would be happy to connect and get these conversations going. And so, yeah, that's about it. I hope you now have a better idea as to what our checklist is all about and what it aims to do. I will now pass the mic over to Meg, who will be facilitating the panel discussion. All right, over to you, Meg.
Wonderful. Thank you so much, Tara. Really great discussion and thoughtful work. And yeah, we really welcome feedback or other ideas about how to make this useful before we finalize it and start sharing it around. But with that, we're going to open up the conversation to think about, when looking at that list of countries, and I see someone from Mozambique just said they want to join too, so that's very welcome. So just to understand better what some of the potentials are and some of the challenges as countries begin to work on digital health strategies. So we're going to benefit from expertise from Alia El Yasser, who is we have to update that title, Director of Gender Rights, Equity, and Sexual Misconduct and Prevention. We'll have Dr. Sanjeev Pugajendi, who's the lead of policy, planning, and development for the Ministry of Health of Seychelles. Dr. Ndifanji Namacha, who's policy manager for Transform Health, and Dr. James Kilu, Digital Health and Rights Project Kenya Community Advisory Team member, among his many other roles. So thank you so much for joining, everybody. Welcome. I don't know if it's possible for us to just ask all my fellow panelists to turn on your cameras, if you would, so we can all see your fabulous faces. Thank you. And thanks so much for joining. It's really great to have you with us. So maybe just to get things started, would like to ask maybe each of you to reflect a little bit on what some of the opportunities are and some of the challenges that countries face in regards to gender equality, human rights, and digital inclusion for health. So Alia, maybe I'll turn to you first, if that's okay. Thanks very much.
Thank you so much, Meg. And I think it's a lot to cover in this short period of time. So I'm going to just try and focus on actually the challenges and zoom out a little bit and look across countries, because it is really sobering that if we look at as of last year, the average is 32% of the world's population remain offline. That's about 2.6 billion people. And that's mostly due to issues related to remoteness and income poverty. And the majority are indeed in rural areas. Our regional office for Europe did a global review last year, and they did find that of the 2.6 billion, 1.8 billion are living in rural areas. So this really drives it home, just to have a reality check. And we know from this review that technology-related issues like poor network connectivity and unreliable infrastructure do restrict access, and these are major challenges that we have to deal with. And that's why it's estimated that 83% of urban dwellers use the internet compared to only 48% of people living in rural areas. So we really do have to have that larger picture where we can see these large disparities. So this is a global issue, but it manifests within countries and it sits with governments to resolve. You also have the issue of, the income poverty, where ownership then becomes a challenge. So despite the fact that, there are more phones or mobile phones in the world than there are people, actually, only 56% of people, particularly in low-income countries, actually own a mobile phone. And even if they have a phone, they can't afford the data plans that are needed to access digital health services. So again, this is something really structural that governments have to deal with. If we lay on top of that, we could look at barriers for women and girls. So we can think in terms of, yes, they maybe face obstacles related to digital literacy and access to digital devices, but there's also all these layers of social, cultural, and family-related factors that actually are holding them back and limiting their engagement. We know that in some countries, adolescent girls and young women are 40 or up to 60% less likely to own a mobile phone than their male peers. So even when we look at the larger disparities within certain groups of the populations, so even in rural areas, the disparities manifest also along gender lines. And so we can all imagine how then age, ethnicity, language, and other factors also intersect, and they can impact access and inclusion. So the challenges that countries face are about devices, about literacy, about connectivity and infrastructure. But I would say maybe the biggest challenges, and maybe those challenges related to devices, literacy, connectivity maybe are offering opportunities for member states to have targeted actions, but there are big challenges that are less visible and less tangible, and for which there isn't actually a quick technical fix. And those are the challenges that relate to deep social and economic structures, which are ultimately define power relations, whether it's across countries, within communities, in families and households. And so maybe that's the toughest type of challenge when you have a discussion like this that we have to unpack. So I'll stop there. Thank you. Back to you.
Thank you. You're not leaving us with any easy answers, but I think that's a beautiful framing of the challenges because, yeah, it's really these cross-cutting forms of inequality, right, that are shaping access and inclusion in many respects. I'm curious to hear, Sanjeev Pugajendi, how you see this playing out in the Seychelles and how you're thinking about this in regards to your new digital health strategy. Thank you. I think you're on mute.
I apologize.
There we go.
Good evening, everyone. I just wanted to maybe just mention the context of Seychelles and then lead into some of the opportunities, challenges maybe that we're facing. We are a very small population, very small country, and it's a small island country, very far from the nearest other landmass. So we have about 120,000 people, and we have a small health system as well. We have been doing a lot around digitizing the health sector, but from a perspective of gender equity and rights, the laws, the constitution of the country does prevent explicitly any discrimination based on race, gender, religion, and so forth. However, in reality, there may be some differences in who has better access and so forth. I know in our case, we have quite a number of difficulties for people, say, with disability to access certain health services or information that they need. And this is an area that probably, again, even up to now, is not yet fully addressed. And we also have challenges for our migrant population that work. We have quite a significant, about 20% of the population are people that come here for work. And often there are language or cultural barriers that often lead to challenges when it comes to accessing healthcare, and even health information or the services. I must say, as the population, when it comes to digital literacy, there are some challenges. We do have, well, I think compulsory classes in schools, for example, for children to learn basic IT skills. But in terms of more advanced, I mean, especially the generation above maybe the age of 50, they often have not had access to such sort of basic learning. But on maybe a positive note, our last census from back in 2022 showed that over 80% of the population actually had a smartphone, and over 90% had a phone of some sort. And I think 70% of the population had access to internet, but I should use the word basic internet. The question as it was framed was not along how fast or the internet is and so forth. But in general, that is, I would say, a positive thing. And maybe something unique in Seychelles is that most of our households are actually female-led and not male-led. And generally women have a strong voice in the family network in Seychelles. That is culturally been and as such, a lot of decisions they are involved in, including decisions around health. We have certain challenges as well around IT expertise in the country. The government has started a sort of a national sort of digital transformation initiative over the last few years, and health is an active participant. We have actually introduced a number of digital solutions in health, and actually we're a few years ago, 2023, late 2023, with the help of the WHO and the Commonwealth, we undertook a digital health maturity assessment, consulting with stakeholders across both public-private health sectors as well as civil society and patient representatives. Interestingly, one of maybe the overarching message we got from there was that there were a lot of digital solutions in use across the country, both in the public and private sector, but a lot of the governance frameworks were missing. And this is a key gap, and one of our aims is to address this gap, both through development of a strategy, but also supporting legislation and so forth. Actually, since the assessment, the country has rolled out the Data Protection Act, which is based on the GDPR. I think it's a big step forward, but we still have a lot of things to do. So maybe I'll stop there. Thank you.
Thank you so much. Really interesting insights, and especially to think about the small island context and what kinds of challenges that poses in terms of infrastructure and reliance on external systems and platforms. Our colleagues in Kenya have pointed out that recently they had an issue where Kenya lost access to some of its e-health information systems when USAID funding cut. So these are kind of aspects of digital development. I don't know if you've experienced anything similar, but
yeah, if I could add,
please.
We do have 3 undersea cables that connect this country overseas to internet, basically, and at any point, if a ship anchors in the wrong spot, one of these cables is cut. We have very severe restrictions in access or speed of internet connectivity. Again, the second and third cable only came in the last 10 years or so. Prior to that, it was much harder. So at least now we have a backup line. So I just thought that might be relevant to the comment you made earlier. Thank you.
Super interesting. Thank you for sharing that insight. I want to pass over to James, who I know is going to point out more human rights issues for us to think about. And I'm hopeful that Ndifanje is going to give us solutions, but not to put you on either of you on the spot. But James, please tell us a bit about your perspectives, especially having come from working on our project and your own work as a medical student in Kenya. Thanks.
Thank you, Meg. Yes, first to say that the situation in Kenya, we really relate to what the past speakers have talked about, the issues of access in the rural areas, but more, I'll just focus more on the human rights aspect. So one of I think the biggest problem that we have in Kenya is the peripheral view we give to gender issues in our policies and guidelines that we have. And we usually say that in Kenya, we don't have a policy problem, we have an implementation problem. But I say sometimes, yes, we have good policies, but they're also quite blind. And the Kenya Digital Strategy was one of the 20 strategies which the team reviewed, and it was clear that it was very blind to the gender issues as it has been articulated, that women in Kenya have less access to mobile phones. Most of them have to share phones. Then you have the issues of economic dependency. And even when we come to the use of digital technologies, they face even more harm. For example, in one of the previous researches, Pay the Cost of Connection, we're looking to issues like technology facilitated abuse. It was like 2 times. It was experienced 2 times more by females and LGBTQ plus individuals. But the policies that we have are very blind to these facts. They take a very umbrella view and solutions to what the problems is defined. If you have technology facilitated abuse, they come with a solution for everybody, but we can say this is not something which is experienced by everybody. When we talk about access, they bring solutions for every population, but we know females have less access to mobile phones. And so the other thing I think is that for us to support individuals to handle these challenges, we also first to be very intentional and recognize their rights. And I think in many African countries, the rights of LGBTQ individuals are very, very, very suppressed. These are not individuals who are recognized in our policy frameworks, even to some extent. These practices are criminalized. So as we come and say that we need to address these gender issues, first we need to go from the core of ensuring first we recognize these individuals, we recognize their rights, then we go to the next step of ensuring that they are captured in our policies that we have, and we translate these policies into practices. Just as I wind up, maybe I can touch what I think is one of the opportunities that we have, and that you have seen the last 3 years across Kenya and other countries. I think we have a very robust youth movement who are very aware of their rights, are very informed. And if we can collect this energy and guide it to the issues that matter, issues of our health, ensuring that we leave no one behind, I think we'll be doing well. And also, we have had a very, very robust civil society movement in Kenya, which we can credit to most of the gains that which we have. But the youth movement, I think, is something to look forward to, which we can see what we can get from it in the next 5 years in regards to health. Thank you.
Thank you, James, and thank you for that inspiring reminder about Kenya's robust civil society and strong youth movement. And it's really important to us to have the youth voice in these conversations, especially because young people today are growing up with this environment, with this digital environment, and understand and experience it in a very, very much an integrated part of the lived reality in a way that older people maybe don't as much. So really appreciate that insight. I'm going to pass over now to Ndifanji to share a bit about thinking from Transform Health and how you all are approaching it, and hopefully give us a little bit of hope for the future. So please, Ndifanji, over to you.
All right. Thank you very much, Meg. I should say that despite the progress that we're seeing, there's still some deep inequalities in digital health systems. And in the policy brief that we launched during the last Digital Health Week at Transform Health, we saw that health data governance is actually one of the key issues that keeps coming up. And, you know, those 785 million women in LMICs remain online. This is not just a connectivity issue, but also an access to health gap. And when women can get online, they're excluded from telemedicine, e-health, but also benefiting from equitable benefits of digital health transformation. So like I said, we have seen that weak data governance is another challenge. And there's been a lot of research that has been written around sexual productive health apps, which will routinely share sensitive data to third parties without consent, putting women, young girls at risk of surveillance and exploitation, but also digital gender-based violence, which silences women online and discouraging their participation in digital health platforms. So these are some of the challenges that we have seen. And just to bring in on what Transform Health is doing, I like how the previous speakers from Kenya, because the Kenya Health Data Governance Framework also anchors digital transformation from an equity, trust, and rights perception. And we hope to see that being implemented soon. But from what Transform Health is doing, we are leading the way, in advancing digital health and spotlighting women and shaping the digital health agenda. And during the last International Women's Day, we spotlighted women, the women database, highlighting some of the women that are working in this space. But also we have been working in health data governance. So we know that at the moment, different governments have got different data laws, but we see that most of these countries, although they have data laws, approximately 79% have general data protection laws, but they don't have health data specific laws. We have seen advances in this in Europe with the European health data space, but also Africa prioritizing the EU data policy framework. So at Transform Health right now, we're working on strengthening legislation and regulation, enforcing health data governance laws that protect privacy, prevent discrimination, and uphold human rights. So we have been working with the Africa CDS at the moment in developing the Continental Health Data Governance Framework, framework, but also we have been advocating for the development of a global health data governance framework, and we continue to do so. So this is some of the advances that we're currently working on at Transform Health, but also through the My Data, Our Health campaign, we have been working with different communities on this issue, raising public and political awareness and mobilizing action for better health data governance, but also allowing people to know who owns the data. There was the issue of, how with the funding cuts, a lot of African countries did lose access to data. And there's always the question on who owns this data actually. Is it Africa? Is it the donor partners? So there's always these issues, and these are some of the areas that we have been working on. Let me stop there for now.
Thank you, Ndifanji. You just put more challenging issues on the table, but I think they're really important ones. This issue of data sovereignty and data colonialism, which I don't think we've explicitly touched on yet, but is a really crucial issue, I think. We think about the dependency for like cloud services in other countries or for technological solutions. How do we begin to support development of locally owned solutions that work for health and that are inclusive for all? This question of data governance, how to create data governance that protects sovereignty but also allows for innovation. So I'm afraid we're not making things any easier for Seychelles as you look towards your digital health strategy. But I'm thinking about like, what are practical solutions? How can we support, progress in these areas and to support development of strategies that are feasible and practical, but that also begin to address some of these issues? And this is really an open question for anyone on the panel, just to start thinking more towards a solution orientation, because we might not solve all of these problems, and definitely we won't, but we do need to make progress however we can. Oh, good. Sanjeev has an answer. Please go ahead.
Again, I do not know if I have a complete answer, but I had a comment or thought around it, in that I am happy to be engaging with colleagues from other countries and organizations on this issue, especially for the context of Seychelles. We would be working on this at some point next year on developing a digital health strategy. It will be the first one that we work on. So this checklist that was introduced, I think, would be ideal. I'm happy to see that the Digital Health and Rights Project has sort of compiled all the important literature around treaties and so forth. So this would definitely be a useful resource for us when we prepare and to develop our digital health strategy. I'm also looking at some of the lessons I see regarding consultations, ensuring representation of all of the groups that need to be understood, if I can put it that way, when it comes to informing the development of the strategy. So I don't know if again, I also like the comment from my colleague from Kenya on it's not the policy that's missing, it's the implementation. And this is an issue in Seychelles as well. We need to design policies that are implementable and not necessarily just look good on paper and tick all the boxes, but the practical realities and so forth needs to be considered. And this is a very common issue in Seychelles. It's a cross-cutting issue. And oftentimes policy development in Seychelles is supported by external partners, and often we don't have local capacity, and sometimes this leads to a lack of ownership of the policy. So sometimes you have somebody, say, from the World Health Organization coming in, helping drive the development of a policy. But oftentimes the teams here may not have been involved to a depth that would allow them to take ownership. So there are some challenges along these lines that I can foresee, but we are learning from past experience, and we are hoping, hoping we are improving in the way we develop policies to make sure that they don't sit on a shelf. Thank you.
Thank you. Really thoughtful reflections. And again, this issue of kind of dependency on external partners, which has been, as we've seen this year, a trend that creates all kinds of challenges. James, please jump in.
Yes, I just make a quick comment on participation because today in Kenya, the community advisory team and DHRP we have the Digital Health Week, and the morning we had a short discussion with a staff from the Ministry of ICT, and what they were talking about how their policies, which are youth inclusive, And towards the end, they asked the audience, how can the youth be involved in the policy development? And the people are not very happy. So out of today's discussion, one of the things which came up is that when you are developing the policies, for example, for gender diverse individuals, for people who are marginalized, we usually get experts to create like the policies, then we push them to the people. So we usually fail to consider the people who are affected. And I like, Sajeev, what you are saying, that you're going to include the people who need to be considered. So I think from the very start, I think it's very important to have inclusion by design. You know, people affected, they are the experts in whatever they're experiencing. So it's important to consider them, to consult them. I think we cannot solve everything, but at least we should be able to get the basics right. Thank you.
Thank you, James. Defanji, did you want to come in on this point?
Yeah, I think in, being part of the solution, I think it's important that we mainstream gender. It's very important that we integrate gender analysis and indicators across digital health strategies, making it part of standard design, budgeting, and evaluation, because I think most of the strategies are not being developed with gender in mind. So it's important that we mainstream gender into the different strategies that different governments are developing, and that way we'll be able to embed gender equity and rights in them. The second thing, we should also invest in people, especially community and primary health workers, because these are the people that bridge the gap between digital systems and the unconnected population. And a lot of the population is unconnected. And as we also know, we know that women make up about 70% of the health workforce, but only 25% of the leadership. So also investing in this community will result in investing in women, and as such leading to inclusion. But also, like I mentioned earlier, it's important to also strengthen the legislation and regulation to enforce the health data governance laws that protect privacy, prevent discrimination, and uphold human rights. But also, it's important that when we have meaningful participation, most of the times we engage women and youth as a sign of tokenism, but it's important that we have meaningful participation of women, youth, and civil societies as co-creators and also accountability partners as we're developing the different strategies. And this is going to be a very important foundation for building trust, equity, and a sustainable transformation. Thank you.
Thanks, Defanji. Yeah, I think totally agree. I think one of the challenges I imagine for a small island country is not very easy because, everybody knows everybody else. So I think it raises probably special challenges in terms of ensuring that these kinds of policies, as Sanjeev has told us, are implementable, but also like ensuring women's meaningful participation. I want to underscore, just mentioned that we did paying the cost of connection. We spoke to female sex workers who said one of the challenges they have is something that sounds like a solution, which actually creates a problem, which is what we began calling the mobile debt spiral. So basically mobile phones, and I'm going to misrepresent this, so I hope James will correct me, but that the mobile phones, if you use up all of your airtime, that you can automatically get 500 Kenyan shillings in additional airtime you then have to pay back. So it's great if you are on the run, you are working, you're a mobile worker, you might need that extra flexibility to enable you to keep working, but then that means you get into debt and your phone, and then you're not able to raise the money that you need in order to pay off that debt. So you then borrow it from a neighbor, and then you owe money to Safaricom and to the neighbor. And so you just wind up getting deeper and deeper into this situation of owing people money and not being able to earn the money that you need to pay it off. So I think that's an example of where actually talking to the end users is really crucial to get insights into something that, to me, this automatic loan, but actually could create all kinds of problems. Sanjeev, please go right ahead.
Thank you.
I
had maybe another contextual challenge that we've had We often have very limited capacity in small countries, but also probably any low resource setting as well. But one of the things, like for example, we often have to, our priorities evolve over time. There might be, I don't know, 3 months we're focusing on digital health, and then maybe the next 3 months are in something completely different. And because it is often the same people wearing different hats, we have many priorities that are sort of stretch people along through the year. And often some of the priorities are determined by political priorities in the country as well. So in that sense, we have a new government that's just come in from 2 weeks ago, and they've put AI in health as a big priority on their manifesto and so forth. So we would be, for example, trying to leverage on this window of opportunity to see how far we can get the resources, get put digital health on the priority list, sort of, so that we can get this done within the next year or so. Also, we often face challenges around policy coherence across the sectors. Digital health is not only in health. I mean, we have to work closely with our colleagues in the digital sector. We call it the Department for Information, Communication and Technology. So there are a lot of laws, a lot of policies that exist already are in the area of digital and information systems in the country, and we do struggle sometimes to make sure that what we're developing aligns fully with all of the legal provisions and existing policies and so forth. And this often creates challenges as well. Sometimes we might put something in a strategy or policy or now on the side of health, but maybe in another policy there's something that's written that's not exactly the same or aligned with what we're saying. So yeah, thank you.
Thank you very much for sharing that insight. That does sound like a number of challenges to navigate in developing a new strategy, and that we're adding to it by asking you to also consult with women, with young people, to check all the other ministries of youth and gender if they exist in Seychelles. But yes, hopefully resulting in something that is more implementable in the long term. I wanted to raise one issue, maybe to turn to Aliyah, because we have these very interesting questions being raised in the chat by Edwin in Kenya, who is pointing out this paradox that we want to promote digital inclusion, but at the same time, that could cause climate issues. And I just wonder if you've reflected on this. I'm not sure if Derek is still with us, but just curious from WHO's perspective, how you balance those two. Thanks.
Thank you, Meg. And Derek is still with us. And actually, I wanted to say that, we're working closely with our colleagues who are working on digital health here in WHO, and actually reflecting on all of the conversation up till now that there is this paradox that, the digital transformation is a double-edged sword, right? Like it has transformative potential, because we know and we can see from examples in countries that some of the digital health interventions can overcome barriers in access to health, because it can overcome this remoteness, etc. Like it and cost, and it can lower cost as well. So I think it's a matter of understanding that this transformation is happening. We have to embrace it, but not to see it as the only way, or that this is going to fix everything and is unproblematic, that there are intended and unintended effects of it. And actually, if there is underlying problems that we haven't fixed, that whatever gets turned digital is just going to recreate those same systems that are problematic, that are causing the inequalities, that are causing a kind of what can I say? I mean, we talk about climate change. I mean, it's an issue of consumption, how we view our right to consume, even, and how do you tackle that, or how do you make informed decisions about your actions as an individual, let alone when you take a step back and think, when governments are trying to make these decisions, how do they balance all of these factors all at once? So I wanted to say, just apropos of the previous conversations, that I think dialogue is so important. that it's not when a strategy is on paper that that's done. The work is just started because it's a best guess at what will work. But you know, you've spoken to whoever you can speak to. You've put in the best ideas into your strategies. But it's so important to continue this. So it's important, I think, and what other panelists have said, that you have to have the conversation early on, embed the thinking early on. But it's even if you do that and you have a good strategy, it doesn't mean you're going to implement it well if you don't continue the dialogue, first of all, and accept the possibility of failure and accommodate that and say, okay, this was the intention, but we're not having the intended effect, or there is something that we could not predict. And so how can you course correct? And that can only happen if you have layers of dialogue. So this, you're talking about, you know, across ministries, between countries, to also kind of correct some of the inequities and inequalities that are happening, you know, that between countries at the global scale, but also with civil society, with communities, with, you know, decentralized government bodies that are closer to communities. We need to embed this in the way that we're working. It should be like that, but definitely when we're going through something that is moving so fast that the regulatory structures are not able to adapt quickly enough. So we're learning as we're going. So I think, yeah, I don't know if that answers your question, but that was my takeaway so far from the conversation in terms of, you know, it's not just one issue. There's so many issues that we have to deal with. And that's the best way to deal with it, is to be all together. But I think Derek wanted to come in maybe and compliment.
Great, thank you. Beautiful reply. Derek, please go ahead.
Yeah, thank you so much. I mean, Dr. Elias has nailed has hit the nail on the head, actually. And I just wanted to perhaps summarize what I would have said in full into 3 key points, especially reflecting on what the esteemed panel has just described. 3 things. First of all, we've heard from the panel members the fact that the issue of you know, accelerating digital transformation through strategies should not be done at the expense of the notion of rights and gender equality. This is something that all the panelists have mentioned. The preconditions of a sustained digital transformation means that the parameters must be holistic, so as to ensure that the implementation of that strategy is holistic as well. Second item is around the member states' appetite on the global strategy on digital health and the regional frameworks. We have a number of frameworks, both at the global level, at the regional level. We're actually going into, in December, at the UNGA +20, a discussion celebrating the use of ICTs in all sectors. The issue of gender equity and rights is central to the WSIS +20 as we march towards the 2030 agenda. So this appetite must be, you know, sort of like be taken advantage of for us to be able to, you know, turn the curve around the exclusion of gender equity and rights. The last point is around best practices. We've heard quite a number of best practices from the panel. There are a number of countries in the African region that are already thinking about the inclusion of gender, you know, equity and rights. And so the appetite that we see in the member states must be harnessed so that we're able to at least, you know, change the course of direction around digital transformation through strategies to be very inclusive. Thank you so much, and I'll need to go to another meeting now. It's been an excellent session. Thank you so much, Meg and team, for organizing us.
Thank you, Derek. Really appreciate you joining us, and all the best to the team. This is a very rich discussion. I can see some fantastic messages in the chat, and I'm going to pass over the microphone now to Tara in the theme of young people leading the way. Tara is now going to chair the Q&A. Over to you, Tara.
Thank you so much, Meg, and thank you all to the panelists. That was a very, very good discussion. I'm sure we've all learned quite a lot. So before we open up the Q&A to the audience, I just wanted to check if Mr. Osvaldo Viegas, the Coordinator of Health Information Systems at the Ministry of Health in Sao Tome and Principe, is on the call to give a first question or make a statement on the discussions held. Just gonna give a shout out to see if he is on the call. Okay, don't think I'm seeing him, must have been caught up in another meeting. So I will begin with the questions in the chat, and then I'll just ask you all, if you do have questions, please add them to the chat and we will read them out. But if you really have a burning question that you'd like to ask, please raise your hand and I will unmute you. All right, so we've got a question here from Doyin. Oyerinde, I hope I said your name correct. You've said, thank you so much for the discussion. I'm particularly interested in this because my PhD research focuses on the gender digital divide in northern Nigeria, where social cultural norms and power relations significantly limit women's digital participation. So even before we get to digital health strengthening, there are barriers in basic access, users, and outcomes. My question is, how do national digital health strategies take these pre-existing inequalities into account meaningfully? Should addressing these foundational gendered digital divides be considered a prerequisite step or integrated directly into digital health planning? Wow, that's a very, very, very good question. I think because Alia did begin touching on some of these aspects, would you like to get us started and respond to Doyen, if that's okay? Thanks.
So you're asking me to respond, okay? Yes?
Yes, please. Just get us started. Yes, please. Yes, please.
Yeah, I mean, the short answer is yes. I think, like I was thinking if I was going to make recommendations to member states, I mean, on how to go about this, I would say think about these issues right from the beginning if you can. So you have to do it. Don't think of it as an add-on. It has to be something that you think about right from the beginning. So it needs to be embedded as you launch, especially this goes for all those member states about to embark on this exercise of developing the strategy. And that's where the checklist is so useful because it is prompting the thinking. And a critical element of that was the data. Whatever data is disaggregated and is available to inform some form of analysis. There is, I don't think there's shortage of data and evidence out there, but try and see what is there and build on that, because I don't think you're going to be able to fix everything, but at least have that as an informed evidence-based kind of strategic planning that can be adapted and changed as you go along. That's what I would say. The principles, the values, the fact that you're thinking about it and trying to address it is going to be a critical first step, I would say. Thank you.
Really, really great insights. Thank you so much, Alia. Would any of the other panelists like to weigh in? Please go ahead, Sanjeev.
I think it's a very important point that was raised along existing inequities when it comes to different population groups, whether it's gender or otherwise. I believe in the broader perspective, there needs to be work done on reducing these inequities. But however, it's work that probably will happen in parallel to work on developing digital health solutions that are more equitable. So I believe it would be an iterative or step-by-step process, but by many stakeholders across society. And as long as the country or society is moving in that right direction, I think we are making progress. So yeah, just to say that there's a lot of other factors, maybe stakeholders involved as well there. And there are, I'm sure, a lot of people doing good work across all our countries. Thank you.
Thank you so much, Sanjeev. Difanji, James, do you have anything to add before we look for other questions? No, okay. I see we have a long comment in the chat by Desiree. Desiree, I don't know if you're on the call. We do have captions available if you'd like to speak in Spanish. I hope everyone has turned on their captions and ask your question. But if not, thank you so much for your comments. We will make sure that if there's anything you need to share, we will share that with the relevant people. So thank you so much. Are there any other questions in the chat? Or any other questions anyone has? I do have a few, but I want to give everyone a chance to first ask their questions. Just going to give it 30 more seconds before I ask some of my questions. Okay, so my first question is to Difanji. You mentioned running a campaign on who owns our data. I'm curious to know, what have you found in terms of the literacy levels and understanding of the different population groups you're engaging regarding who owns that data and how they can protect their privacy online?
All right. So this is a Where's My Data campaign, My Data Our Health campaign. So through this campaign, Transform Health has been engaging communities on this issue to raise public awareness and mobilize action for better data governance. So basically with this campaign, we ask communities to go to the health facility and demand access to their health data. And it's been interesting, like, you know, different people go to different facilities in different countries, and some will say, okay, I want to access my data, and they go like, you need to write the minister to get access to your data, or you need to tell us why, or your data does not belong to you, it belongs to the facility. So this has just helped to raise public awareness on, you know, data use and data ownership. And the campaign reviewed that many people, about 80%, were unable to access their own health data, with about 70% being unaware of who collected it. And nearly 70% of the respondents also indicated that they did not feel confident that their data was well protected. So I'll share some findings in the chat, but it is quite an interesting campaign. And I'd urge some of the participants here to just go to the facility and ask for their data and see the responses that they get.
That's really great. Thank you so much, Difanji. I will move on to my next question. If there are no other questions from the audience, do we have any other questions? Okay, we have questions about the recording. And yes, we will be uploading this conversation on YouTube. Maybe I'll ask James a quick question. What would you say are the best practices with respect to inclusion and participation that you've seen? They don't have to be specific to policy development, but it would be good to know, you know, sort of what do you think would be the...
We asked you to find out how much control you had over your health data.
Okay, thank you.
Okay.
So,
Oh,
sorry, did you
yes,
hear?
Yes, I got the question. So,
okay, good.
Of course, there are many models for inclusion and participation, and ensuring that the voices, the experiences of people who experience inequalities are captured. But I can only talk of what I've experienced and what I know. So, for example, we were in Kitui. We were in Kitui 2 months ago, 1 month ago in September, where we engaged the study participants about the results of the pain, the cost of connection findings. And one of the things which comes up is that the discussions about access, digital literacy, they usually limited in the capital of Nairobi in the capital of Kenya, in Nairobi, while the people experience those disparities down there in Kitui are never involved. So one of the big solutions would be things like we make mobile phones cheaper, the thing which Meg was talking about. We loan people airtime, and then we have like having connection enslaving people into debt. But you go there, they don't even have electricity. So first, how will they charge the phones? So the best model of participation is to ensure that the people who are all live those inequalities, people with the lived experiences, are involved in the policy process and implementation meaningfully, not in a tokenistic way. And DHRP has tried this for 3 years now through the participatory action research, forming small groups of people with diverse knowledge by working with community members of the key populations, civil society, academia, who have lived in inequalities and who have interacted with the people in inequalities. So they bring the raw data, the real deal which happens in the society. So I think that's the best way to meaningfully engage people. And I hope that is a lesson that the group institutions will take into account. They can talk to make more, will tell them how they have been able to do this successfully in 4 countries.
Thank you so much, James. I don't know if any of the panelists or Meg would like to add on to what James is saying before I move on to the next question, or we get questions from the audience.
Yeah, thanks so much. And really appreciate the shout out, James. We continue to try to learn, in collaboration with young people in our 4 focus countries about how to do participatory action research. We've drawn a lot from lessons from the global HIV response, where there's been quite a bit of work to think through power inequalities in decision making and how we ensure that diverse people, including young people, excuse me, who are living with or affected by HIV, have a seat at the table and actually have a meaningful, not just seat at the table, but actually have a vote that is equal to others. And we found that to be really powerful, both to create better work, better outcomes. We feel our report is better because it went through about 10 revisions with lots of people's input. It had young people who helped develop all of the recommendations in each of the countries based on our evidence. But also we find that it builds trust. So as one of the young people in our study said, if you have the opportunity to provide feedback, then you get the trust of the people. And I think that's true. I think it's not quite always that simple, because sometimes people give you feedback that you can't act on, and then they get frustrated with you. But it is important to have that channel for communication, and that it's not simply a top-down exercise, but that you build ownership through having diverse stakeholders engaged in different ways throughout the process. And so that's something we're also thinking about how to do when we think about governance of technology, governance of artificial intelligence. This is something that's usually left to so-called experts, right? And the experts tend to look a little bit like me. So the question is, how do we change that dynamic? How do you wind up with a dynamic where different kinds of expertise are considered and valued, and where expertise begins to be shared and developed in different ways, so that we change that dynamic and begin to have something that works better for different groups of people. But I think, with developing a national strategy, I think Sanjeev has pointed out really helpfully some of the challenges for someone who's developing a strategy that include dealing with the political pressures, changing personnel in political offices, lack of resources to do the strategic consultations. All these other factors are real world constraints that can limit what gets considered and how a strategy is developed. Anyway, sorry, I went on a little bit, but thanks very much for that prompt, James.
No, thank you so much, Meg. I see we have a Victoria, and he asks how implementation process and implemented capacities to ensure digital health initiatives meaningfully advance gender equality, equity, and human rights practice. Be good to hear from all the panelists. Maybe if that's okay. Do you have any insights to share?
Tara, you're breaking up a little bit. You want to repeat that? Sorry.
So do you get a question?
Maybe you start again. Yeah, thanks.
Okay. We have a question for that. I don't know what connection is up to date, but we have a question from John Mashari, who asks, how can strengthen both implementation processes and implementers' capacities to ensure that digital health initiatives meaningfully address gender equality, equity, and human rights? I hope all have, and maybe we could start with Jeev, and can you have
Yeah, it is breaking up a bit, but I think we can see John's question. So maybe we just see if anyone, if you can hear me, if I'm not breaking up, because my internet is also wobbly today. Is there anyone on the panel that would like to answer that?
I think Tara asked Sanjeev to kick us off. If Sanjeev would like, I think it's important for the Ministry of Health perspective to kick off the discussion. Dr. Sanjeev, do you feel comfortable answering your question?
I can try, or maybe at least partly. I think one point that was mentioned again, I'm probably restating it here, is co-developing digital solutions and co-implementing them with the people that are going to use them regularly. I think from capacity building, what we've noticed from our experience is that we do have a number of digital solutions, including electronic medical records and a number of other solutions in the public health area as well. But the way that capacity is built, again, we probably, there's a lot of, like we often bring people together into like a classroom kind of setting and show them how these solutions work, and fail to spend time at the site where they're working, where they're using the solutions, and look at the practical challenges. So oftentimes after we rolled out electronic medical records, we have teams like almost weekly or every few days having to go on site for troubleshooting and so forth. As probably this could have been avoided if we had spent a day or two on site with them, hands-on, and going through the challenges with them and improving the system itself. The other maybe issue is that we sometimes use proprietary digital solutions that are not very flexible. So sometimes we end up having to adapt our practice to the solution. And this is sometimes may make things maybe more complicated as well. So that is another issue we noticed as well. So I know WHO has been advocating for use of open source solutions. Again, it has a cost advantage as well, but it is not always, the case when it comes to the combination of the different factors that influence the decision on which solutions to use. So for example, our electronic medical record system is a proprietary solution. We have been discussing aspects that we touched on earlier around data ownership and so forth. We've actually, I can tell you, we've had to, we host the platform within our government servers, and we've actually taken it offline. It's only accessible within the government network, sort of, so that this was done in view of the risk of cyber attacks that especially have been targeting health systems lately in Western countries. And as a precautionary result, we've had to take it off. But this itself caused a barrier. All our staff going on home visits or outreach cannot access the system on the Wi-Fi or something like that. So we're now in discussions with our IT team on how we can provide secure access in a way that it doesn't increase the vulnerability of the system to hacking and cyber attacks. Just sharing an experience or thought related to that there. But the working closely with partners, especially, I personally am not a digital expert, I'm not an IT expert, so I am learning in the process as we progress towards improving our governance frameworks and safe use of digital solutions. So having these discussions with people in other fields of expertise has been critical for us to understand where, maybe from a health perspective, this is how you think, but there are so many other things that we need to take into consideration to make for digital solutions to be practically feasible and useful to the people that need it. Thank you.
Thank you so much. I think that was a very good example of some of the ways to tackle the practical challenges you face with these systems. Thank you so much. I can see Difanji's hand is up, and then Alia after that. So please go ahead, Difanji.
No, I think it all goes back to nothing for us without us. I think most of the digital health tools are developed without women in mind. and women in the process of development. So I just would like to reiterate some of the recommendations from the Transform Health Policy Brief establishing gender equitable transformation in digital health. I think it's important that we apply a human-centered design to women needs and increased representation of women in digital health. From a policy perspective, from an innovator's perspective, it's important that we have women at the center of this, and not just, like I said earlier, not from a tokenism perspective, but for them to actually be involved in the development of this. Investing in people, infrastructure, and systems. I think it's important for us to address the health worker deficit, invest in reliable digital infrastructure. I think we've talked about, the donor dependence, but also different technological issues and climate issues that affect the digital infrastructure. So it's important to have reliable digital infrastructure, build digital literacy among health workers, women and girls, so that they're also able to use the digital tools, because there's also an issue of having tools, but the women and girls are not being able to have the right capacity to use this. But also lastly, strengthening the legislation and regulation. I'll reiterate this over and over again, because one of the studies that we conducted at Transform Health, we found that online gender-based violence actually limits access and use of digital tools for a lot of women and girls. So it's important that we strengthen the legislation and regulation to enforce legislation, eliminating online violence, strengthening health data governance, protecting the rights of women, and in order to promote equity and regulate artificial intelligence to protect human rights and dignity. That's what I wanted to add. Thank you.
Thank you so much, Ndifanji. We'll just hear from Alia, and then I'll hand it over to Meg to close the webinar. Thank you so much. Please go ahead, Alia.
Thank you, Tara, and thank you to the panelists. I fully agree with everything that my fellow panelists have already said. And it just brings to mind, and I'm trying to answer Meg's question about the opportunity, because the work is out there. There is work out there that we can learn from and build on. And I think about the report that you did last year, when you're looking at the practices from that 20 health strategies, digital health strategies that you reviewed. So, you can see some governments really going out there trying to do things a little bit differently by engaging others. And it comes to mind the example from Lebanon, where they are engaged not only the Ministry of Telecommunications and Ministry of Health, but they've brought on board the Ministry of Education, so that they're trying to push digital literacy, and they're trying to target not only the health workers, but the patients as well. So having this kind of integrated, holistic approach, that seems to be the way to go. And you can expand on that and bring other ministers on board that are there to tackle those issues on the advancement of gender equality and human rights. And that's their bread and butter. And if they're involved in these kinds of initiatives, they will make sure that it is embedded in the implementation. So that's one. And very much building on also what's been said, I think the performance indicators. So when performance indicators are clearly there and you set targets that you're trying to reach on these issues, so they're not necessarily directly health related, but you have them there. And also your means of measurement, maybe you rethink. Maybe you do these focus group discussions, you go to the communities, you do these kinds of, the action research as a way to monitor whether you are on the right path or not, and be able to rectify would be key. And I wanted to say, this is kind of the larger picture ways of doing things, but even what is already there. And again, I think about the report that you did last year when you look at, for the example of South Africa, where there are all of these digital health, mobile health apps out there, but the government is intent on vetting, prioritizing those that are closer to communities. This kind of prioritization and vetting will increase trust in those services, and therefore will increase uptake, and therefore will increase impact. So I think there's a lot that positive things being done, can be done. It's not impossible, but to embrace the complexity of this. The things that we're talking about are not easy to fix. They're not a quick fix. They're not technical. It's not about building something and within a short time frame, but the commitment to doing it and embracing the complexity of it, I think, is key for success. Thank you. Back to you.
Thank you so much. Really, really great insights. Because we are out of time, I'll just pass over to Meg to give quick closing remarks and share some of our next events. All right. Thank you all.
Thank you so much to all of our panelists, and thank you, Tara, for your gracious co-hosting. And also a big thank you to Javier and Sakshan behind the scenes for making everything go smoothly. So we should have a slide in a sec showing our next webinar in this series, which will be in early 2026. Believe it or not, we're already looking at next year. So that's in January 2026. We'll have this kind of conversation again with colleagues in Southeast Asia. And then on 5th March, just before International Women's Day in the MENA region or Eastern Mediterranean. So please do join us. I think the link should be in the chat in a sec to sign up for future alerts for these webinars. Also, I just wanted to flag a lot of our colleagues are going to be at ICASA in Ghana, at the Health AI Global Governance Forum in Nairobi, and the Global Digital Health Forum in Nairobi. So really look out for us there and hope to see you all there. And thank you so much again to everyone for wonderful contributions to this very rich discussion. Have a great day. Bye-bye.